Okay, good afternoon, everyone. I am Jill Swartz from Specialty Med Training, and I'm delighted to be here with Dr. Kathleen Russo from Carolina Health Span in Charlotte, North Carolina, and her second location in Huntersville, North Carolina. Hi, Dr. Russo. Good afternoon.
How are you, Jill? Nice to see you.
Nice to see you as well. So we're continuing our education series, and we're having a great time doing this for your patients and for the public in general. So I want you to tell us a little bit about Carolina Health Span to some of the new viewers that we have joining us. And yeah, then we'll move right into our next topic. So tell us a little bit about Carolina Health Span.
Sure. So Carolina Health Span Institute was founded in May of 2004. So quite a while ago, and we actually have two locations, one in Charlotte and one in the Lake Norman area. And we are staffed by MDs. And in addition to our medical doctorate degrees, we all have credentials either in integrative medicine, functional medicine, also sexual wellness. And I personally have a 2-year fellowship in integrated medicine, and I trained with Dr. Andrew Weil through the University of Arizona Medical School. And many of you may know his name. He's considered the founder or the grandfather of integrative medicine. So a very smart and influential person in the functional medicine and integrative space. So we've been around a lot.
I will say so.
We've been taking care of patients for many years, and it's important to know who your provider is. It's also important to know where your medications are coming from, particularly when we talk about some of these less mainstream therapies.
Yes, very important. You know, there's a lot of integrative practices out there, but there are so many important components to who you're actually getting treated by, and the specialty and the education that they have in this area. Well, thank you so much for explaining that, and I'm excited to share with everyone that today's topic is on peptide therapy. So these are such new cutting edge treatments, and I field a lot of questions about peptide therapy. So I'm excited for you to be able to share some insight on peptides for everyone. So yeah, please let us know, what are peptides and what they do and how they can help and what's so important about them for our long-term health and longevity.
Right. Well, I love talking about peptides. They're quite amazing, and they are a way to optimize your health. Many of our patients are already doing hormone replacement therapy, which is anti-aging therapy, and I'd like to think about peptides as another level of optimization. So simply, peptides are short chains of amino acids, less than 100 amino acids long. Longer ones are what we call proteins. So these are actually just short chains of amino acids, and they act as signaling molecules, which means that they have very specific interactions. Our body knows what they are. Our body makes them and knows how to handle them, to metabolize them and detoxify them. So they have a very favorable safety profile, and we can use them in very specific precision medicine type ways.
Wonderful. So I think it's very interesting that you say that they're not pharmaceuticals, because I think that's very misunderstood in the marketplace. And in fact, I've seen the term pharmaceutical peptides. So these are something that your body makes. I'm asking this question because I would like some clarification. Or it's something augmented to help your body sort of signal these different this cascade of benefits.
Because they are naturally occurring substances, they cannot be patented. And that's why they're not pharmaceuticals. The pharmaceutical companies can't touch them. Not unlike some of our bioidentical hormones. Again, they're naturally occurring, and so they can't be patented.
Okay, thank you for clarifying that. All right, so I'd love to talk about like the benefits of peptides and really who benefits are or benefits the most from peptides. So this is a nice long list, but if you could speak to that, that would be wonderful.
So we have many different peptides, and they all have specific actions, and they can increase energy, increase growth hormone, increase muscle mass and lean body composition. They're great for sexual functioning and libido, brain health and cognitive functioning. Sleep, deep sleep can be improved. They're good for hair, disease prevention. They can improve your GI tract and gastric inflammation. So many benefits, and we have many different peptides from which to choose that target the specific area that we may be interested. So as you can see from the list of benefits, many people can benefit from peptides. So those people who are struggling with weight management, that no matter what they do, they can't seem to lose any weight. They can be helpful for those people who have trouble with low energy, maybe athletes who are looking to have improved workout recovery or more stamina, endurance. People struggle with poor gut health, sexual side effects. So peptides can really benefit almost anyone. And when you do meet with your provider, you can discuss what your goals and your concerns are, and we can choose the peptide that may be best for you.
They literally sound like miracle workers. Is there anyone that should not take peptides?
There are some contraindications, and that's something that your provider would talk with you about. But for the most part, there's a very favorable safety profile, and most people would benefit. But at Carolina Health Span, we see all of our patients in consultation initially. We will review your medical history, your medications, your goals, your concerns. In some cases, check lab work, and then decide, are you a good candidate, and give you informed consent and instruction about the risks and the benefits so that you can make a decision that is best for you.
Okay, great. So please do explain some. You mentioned that there's quite a bit of different types of peptides for specific areas. So I'd love to kind of go through those. I see on the slides that we're talking specifically. So I'd love to learn more about each and every one.
Okay, so I'm just basically talk about the more popular or widely used peptides for this discussion. I'd like to start with CJC 1295 and ipamorelin. Sometimes sermorelin is combined with ipamorelin. And these peptides are what we call growth hormone secretagogues, meaning that they increase your natural production of growth hormone and release of growth hormone. And as many of you know, growth hormone is considered the fountain of youth. It is cognitive sharpness, it is good mood, it's good body composition, energy, stamina, endurance, good sexual functioning. So growth hormone is something that is made in our pituitary gland, and it naturally starts to decrease with age. Typically after the age of 35, our levels start declining. And these peptides will increase your natural production and release of growth hormone. And so you can benefit from having more growth hormone in your system. And it's a very natural physiologic way of doing it, as opposed to taking just growth hormone directly. Very favorable safety profile, and just many benefits. Patients just love it and do very well. It's particularly good for deep sleep also. The next peptide that is very exciting is BPC 157. BPC stands for body protection compound, and it is a peptide that's actually naturally occurring in our gastric juices. And it can be taken as an injection. It can also be taken orally. When you take it orally, it can improve gut inflammation and gastritis, ulcers in the stomach. When we take it injectable, it's very good for musculoskeletal injury, post-surgery, pain, inflammation, tendon to bone, ligaments. So just really is very impactful for musculoskeletal inflammation and pain. And then some of the others are thymosin beta-4, which does also promote fast healing and reduces inflammation. Then we have some peptides that we call exercise mimetics, meaning that they actually can mimic exercise, and they help improve our athletic performance and increase our muscle gain. MOTSC is one of them. It increases mitochondrial function, which are the little powerhouses inside of our cells. Again, CJC 1295 and ipamorelin, the growth hormone releasing hormone, and peptide can also increase athletic performance, VO2 max, help you recover quicker from your exercise. We talked briefly already about BPC 157 to reduce gut inflammation and gastritis, and typically that peptide is taken orally.
Well, I think it's quite fascinating that they're so specific to some specific areas. So I think that's so helpful, I suppose, for you as of course a provider, but for a patient looking to really target specific areas.
We also have peptides for immunity. Melanotan 2 is one of them. Apidolon is really quite interesting. It's an anti-aging and longevity peptide. So it actually can increase or help maintain the length of telomeres. And telomeres are those little caps on the end of our chromosomes. And so epitalon can be very impactful there. Sexual health, we have melanotan 2, but also PT141. And that improves ED. It also increases libido in both men and women, and it can be very effective. Then there's GHK copper, which we use that in a few different delivery forms. We can use it topically in cosmetics in terms of increasing collagen, improving the condition of the skin, reducing wrinkles and fine lines. We use it in hair restoration some. And then also we can do it as an injectable to reduce inflammation as well.
I think what's truly important to state here is that these are just additional tools that you have in your toolbox, if you will. It is part of an integrative longevity practice. So it's so important for these listeners and to understand just how much resources available when you're going to a integrative physician like yourself and at the likes of all the providers at Carolina HealthSpan. It's so much knowledge and there's so many resources out there, but to working with an expert like yourself in your clinic that really understands how to apply all of these therapies in combination and to really create an optimal outcome for your patients and for their health and longevity. It's quite important. You're a unique practice in that respect. You really are.
Well, thank you. Like I said, peptides can be another level of optimization for those people who are looking to be, 100% and want to have longevity and anti-aging benefits. And actually, I have a clinical pearl that I'd like to share. For those of you who may be interested in doing the growth hormone secretagogues like CJC 1295, one of the things that I like to pair that peptide with is a period of calorie restriction or fasting. And so one of the things that I personally like to do is do a cycle or a course of the injectable growth hormone releasing hormone for a couple of months, and then follow with 1 month of either calorie restriction or a fasting mimicking diet. And the reason is because we know in anti-aging research that the genes associated with aging are nutrient sensing genes, meaning food, nutrition turns them on. And when we're fasting, the genes associated with aging are turned off. So do a 5-day water fast, for instance, we have upregulation of our growth hormone, we have upregulation and production of stem cells, we turn off those genes associated with aging, and we know what those genes are. We have reduced insulin levels, reduced CRP levels, we lose weight, our metabolism improves. And so, but a 5-day water fast is pretty difficult. So there is a product that I usually will recommend, and it's a 5-day fasting mimicking diet. And essentially the researcher who developed the particular product I'm talking about, he figured out what macronutrient ratio and what calorie threshold you need to trick your body into thinking it's doing a 5-day water fast. And so the product he developed does have some food, some bars and soups and so forth that you consume during the 5 days. So you're not actually totally fasting, but it tricks your body into thinking you're having a 5-day water fast, and you have all those same cellular changes that you would as if you were fasting. So it's a great way to increase the benefits from your growth hormone secretagogue. The two of them together are synergistic, meaning that you get more than each of them on their own. They just kind of increase the effects of one another. And when you come in to see your provider, ask about would a fasting or calorie restriction protocol be good for you to use in combination with your growth hormone secretagogue.
Well, that sounds fascinating. I think maybe that could be our next topic that you could talk on, because you've definitely piqued my interest in that. But yeah, I think again to say that there are so many different therapies and so much knowledge that you wrap around this health span, benefits of working with a provider like yourself. So thank you so much for sharing, and we really do appreciate the type of care that you offer, that you really dive deep into wellness. And it's a unique aspect to medicine in today. So we're very grateful that you're able to not just offer this and share it with us.
Yeah, it was nice talking with you. Thank you very much.
You're so welcome, Dr. Russo. Stay tuned for our next one, and have a wonderful weekend.
You too. Thank you. Bye-bye.